We're back now taking a look at some of the questions that you at home are asking Dr. Darien, and here's one. How much vitamin D do I really need, and when should I use a supplement? That's from Kara H.
Great question. Commonly people ask about vitamin D. It's associated with many other factors in our life, reducing the risk of chronic disease, helping with longevity. For the most part, the vitamin D can be found in the foods that we eat. You want to look for fortified foods, for example, especially for kids. And then for adults, you can choose a supplement. The minimum recommendation for most adults under the age of 70 is around 600 international units. Over the age of 70, you need a little bit more vitamin D, around 800 international units. And remember, taking more doesn't mean more benefits. So you want to follow the guidelines, especially on those over-the-counter medications.
Can you also just go outside?
You can also go outside, and remembering that sunblock does not prevent vitamin D absorption, so protect your skin, and you can also go outside. That helps you replenish some of that important vitamin D.
Yeah, outside is free. Your prescription for wellness?
It's about bloating. We were talking about it early on in the week, and it inspired my prescription today.
Oh, great.
So what certain things, just for information, I was the one that was bloated. What things can we do to reduce our risk of bloating? The number one thing you can do, and this is what our parents have all taught us, chew your food slowly. When you chew your foods fast, or when you're talking while you're eating, you're inhaling air in the wrong spaces. That can increase your risk of bloating. Also, carbonated beverages, as you probably can imagine, would increase your risk. Lactose, but also look for ingredients like sorbitol, mannitol, or maltitol. That increases your risk of bloating. That can be found in sugar-free products. And then taking a walk. This is something that is new for me in the past year or two. Taking a walk immediately after meals helps to reduce bloating. Also, if you do it immediately after for at least 30 minutes, that is associated with weight loss. So taking that walk, so important, so helpful, and you can get that bloating out before you get back to your house.
Before you get back to your house.
There were so many cues in there about things I'm not going to say out loud.
Take a walk. It's not difficult. It's not difficult. As soon as you're done eating. As soon as you're done eating.
You sure you don't want to see it? All right, Doc, thank you.
Of course.
And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABCGMA3.